Thank you, Mr. Chairman and members of the Appropriations Committee for taking the time today to listen to my comments. Like all of you, my number one priority as a state representative is the welfare of the citizens who elected me. In my case, that specifically translates to the desire to establish a much-needed medical facility in northern Dauphin County. Years before I joined the ranks of the legislature, I purchased a real estate company from a 50-year-old gentleman from that area. It was 1986, he was recently married, and was blessed with a much-loved and long-awaited baby daughter. Having sold the real estate portion of his company, he was looking forward to spending more quality time with his family. Life was supposed to be good. Instead, he suffered a heart attack in his Carsonville, Halifax home. The ambulance was called immediately, but doctors said it took too long to get him to the hospital. They said he fought to survive, but he didn't make it. Since that time, years before I was elected, I wondered how all of us, could prevent such a situation. If a person has a heart attack, minutes count. It's common knowledge that acting quickly can reduce the damage of a person's heart and increase their chance of survival. In northern Dauphin County, it's 45 minutes in any direction to get to emergency health care. That's particularly bad for the victims of heart attacks or strokes who need immediate medical attention. Northern Dauphin County is a rural but growing community. The need for a medical facility is critical and increasing. The development of such a facility should start immediately to meet the current and fast-approaching future needs of that area. There are 2 family practice centers in northern Dauphin County. However, they are only open 9 to 5 on weekdays and 2 Saturdays a month. They have no accommodation or physician to handle strokes or heart attacks. Since 2007, I have been actively pursuing the placement of a medical facility in northern Dauphin County. This includes government and non-government solutions, legislative and administrative approaches. I recognize that any solution to this problem will involve a public-private support. I have spoken to officials of major hospitals and healthcare entities. They acknowledge the need, they offer support, but they need to see a commitment from the Commonwealth of Pennsylvania. In 2008, I had a $20 million authorization added to the state's capital budget, and I've continued to battle for the medical facility and its funding ever since. In September of that year, the House Republican Policy Committee held a hearing in Lycans regarding a medical facility. The room was packed. Legislators and lobbyists were shocked at the turnout, and importantly, the concern expressed by area residents. Several legislators were late to the policy hearing because they viewed me as a city girl, as they knew I represented Dauphin County, and after all, they came to Harrisburg City, Dauphin County, to work. They didn't view the 104th District as a rural area and didn't expect to the nearly 1-hour ride from Harrisburg to Lycans. And that's the point. Travel between northern Dauphin County and hospitals in Harrisburg or Hershey, or Danville and Montour County, or Pottsville and Schuylkill County is 45 minutes to an hour, especially if one gets caught behind a slow-moving vehicle or farm equipment on one of the winding and mountainous 2-lane roads. The areas in question are not served by interstates or 4-lane highways. They are rural but growing areas and areas of need. The greatest need is an adequately emergency health care facility. I ask your support at this time for $5 million of the $20 million capital expenditure listed in House Bill 1589 of 2007 to fill this need. And I ask your support for line item 237 of the 2014-15 Governor's proposed budget to expand access to primary care services in rural and underserved areas of Pennsylvania. His proposal would provide an additional $4 million to provide loan repayment assurance to healthcare practitioners who commit to working in primary care in rural and underserved areas of the Commonwealth. Charles Dickens once wrote, "There is nothing so strong or safe in an emergency of life as the simple truth." It is the simple truth that emergency health care is very much in need in rural areas, especially northern Dauphin County. I'm asking for this money today, but I also would like to say that in addition to the hearing that we had, Dauphin County also did do a study, invested quite a bit of money in it, and can back up what I'm saying today. I'd just like to thank the chairman and the members of the Appropriations Committee for listening to me today, and I hope you will consider my request.